We're live.
Good afternoon. It's the 8th of September, 2021, and I'd like to welcome everyone to the first meeting of the House Cannabis Legalization Workgroup. This is a virtual meeting, so please be patient if we encounter any tech or streaming issues. Before we begin, I remind the workgroup members that this briefing is being streamed on the Maryland General Assembly's YouTube channel. Workgroup members are going to be muted through the briefing. If you have a question after the presentation here this afternoon, please use your hand or raise your hand function to within the Zoom window. After I recognize you to ask a question, please wait a moment and Dylan will unmute your screen. On July 16th, 2021, Speaker Adrian Jones announced the creation of this workgroup to craft the implementation of a legalized cannabis program in Maryland. The House of Delegates will pass a measure to put the question of legalization on the ballot for the 2022 general election. This work group will continue meeting throughout the 2021 to 22 interim so that if approved by the voters, implementing legislation will be ready for the 2023 legislative session. As I have previously stated, and others have stated, cannabis use has had a disparate impact on people of color for far too long, with no real impact on public safety. This work group will establish the legal frameworks necessary to fully implement the legalization of marijuana and learn from the mistakes that other states have made before us. The Speaker has been clear with me that we will do this with an eye towards equity and consideration to Black and brown neighborhoods and businesses that have been historically impacted by cannabis use. I know as well that the Speaker has concerns about the impact of cannabis use on children and on young people. And we're going to receive information and data from expert witnesses to ensure the health and safety of all Marylanders throughout the process. So as outlined by the Speaker, this work group will determine the regulatory licensing and oversight structure of the production, sale, and possession of legalized cannabis, including the licensing application process, the number of licenses, and equity in ownership of marijuana facilities. We will address expungement of previous convictions for cannabis and determine changes to existing criminal laws related to cannabis. We will identify the structure for potential release of those convicted solely of marijuana-related crimes, as well as dismissal of pending marijuana charges. We will review existing criminal and traffic laws related to marijuana, including paraphernalia and cannabis accessories. We'll structure equitable ownership in cannabis-related businesses, construct social equity programs to compensate communities impacted by over-incarceration for marijuana-related crimes, craft a taxation statute or structure and revenue distribution from cannabis proceeds, expand addiction treatment programs and healthcare support for substance abuse, and will determine the impact to medical cannabis programs and other collateral rights and licenses. With that, I'll introduce the subcommittee chairs and the members of the work group who are here with us today. She is off the screen right now, but we have the vice chair of the work group, Delegate Jocelyn Pena-Melnick, who is also the vice chair of the Health and Government Operations Committee, who will chair the Health Determinants Subcommittee. We have Majority Leader Eric Lutke, who is unable to be with us today, who will chair the Cannabis Taxation Subcommittee and is on the Ways and Means Committee. We have the Delegate C.T. Wilson, who will chair the Business Implementation Subcommittee, who is with us, and Delegate David Moon, who will chair the Criminal Justice Impacts Subcommittee. The chair of the Legislative Black Caucus is with us and is part of the work group, Delegate Daryl Barnes. Delegate Jason Buckle, the Minority Leader, is on, but is not yet on the screen. The Vice Chair of the Economic Matters Committee, Kathleen Dumais. Delegate Kathleen Dumais is on the work group, as well as Delegate Nicole Williams from the Judiciary Committee, Delegate Robin Grammer, who can't be with us today because of a family matter, and Delegate Nick Kipke from the Health and Government Operations Committee. Over the next couple of weeks, I'll communicate to work group members about your subcommittee assignments. And before we move forward with our presentation, our full work group will meet several times between now and the next legislative session. We're going to receive briefings related to each subcommittee topic from various guests and expert witnesses. Keep in mind these dates and exact times will be shared with work group members and posted on the MGA website after this meeting concludes. Our next full work group meetings will take place on first Wednesday, October 13th, where we will receive a briefing related to health determinants. Wednesday, October 27th, where we will receive a briefing related to criminal justice impacts. Tuesday, the 9th of November, where we will receive a briefing related to business implementation and regulation. And Wednesday, December 1st, where we will receive a briefing related to taxation. Our work group and the associated subcommittees will continue to meet beyond December 1st and into the 2022 legislative session. And we will provide those dates when days and times are considered and finalized. If you have any questions, you can send an email to Dylan Goldberg in my office at Dylan, D-Y-L-A-N, .Goldberg, G-O-L-D-B-E-R-G, at mlis.state.md.us. Now, before we begin our presentation again, I'd like to highlight one of the documents that your office has received before this meeting. Aaron Hopwood, who is staff with the Health and Government Operations Committee, she's going to be our work group's counsel from the Department of Legislative Services. She has drafted an item that Dylan is going to screen share, and there it is. This document provides an overview of the steps that Maryland has taken related to medical cannabis legalization, cannabis decriminalization, and regulation throughout the previous decade. For the public, this document will be posted to our work group page on the MGA website. And if any work group members have questions, you can contact Aaron directly at Aaron.Hopwood, Hopwood, at mlis.state.md.us. And members of the work group should already have that document in hand. So now we're going to begin. We'll receive a briefing related to the background of cannabis legalization across the nation. As of today, 18 states, 2 territories, and the District of Columbia have legalized small amounts of cannabis for adult recreational use. While many of those jurisdictions took unique steps to achieve the legalization of cannabis, many of those states and their state governments encountered similar societal and legislative obstacles in the process. To help us better understand the background and context of these actions across the nation, I'd like to introduce Dr. John Hudak. He's the Deputy Director at the Center for Effective Public Management and a Senior Fellow in Governance Studies at the Brookings Institution. In 2018, Dr. Hudak authored a book called Marijuana, A Short History. His research provides a profile of how cannabis emerged from the shadows of counterculture and illegality to ultimately come into focus as a mainstream public policy issue. We'll take questions after his presentation, and we do hope to finish by 3 o'clock. We'll see. But on behalf of the work group, we appreciate you for being with us, Dr. Hudak, and we look forward to your remarks. And whenever you're ready, you go right ahead. I think there's a PowerPoint going along with this as well.
Mr. Chairman, thank you. Madam Vice Chair, thank you, and members of the committee. Thank you for the opportunity to present today to this important work group for the state of Maryland on a critically important issue. I'm going to have a PowerPoint presentation with portions of my presentation today to provide some background information and some data and charts. Dylan has been kind enough and patient enough to help advance those slides, and during portions of the talk where I won't be relying on the PowerPoint, he'll take it down and then put it back up at appropriate times. But Dylan, we can start early. We can start with at least the title page for the PowerPoint slide. Very briefly, and as the chairman mentioned in his opening remarks, laws in the United States have been discriminatory from their start. That wasn't accidental. It was by design. In the 1920s, 1930s, and moving forward, cannabis was seen as a product and a political opportunity to be able to divide Americans against outgroups. Those outgroups included Mexican immigrants and Mexican Americans, African Americans, hippies, beatniks, Jews, a whole variety of groups who were seen as both problems, quote unquote, problems in society, and cannabis users for whom public officials at the state and federal levels could vilify and use cannabis laws to hold down. And that campaign that we commonly call the war on drugs was wildly successful in terms of advancing racist efforts and racist policy goals. And the result now that we have is a system that institutionalizes racism and creates a society in which, even though whites and non-whites in the United States use cannabis at about the same rates, we know that Americans of color, people of color in the United States, are arrested and convicted for cannabis-related offenses at significantly higher rates than their white counterparts. But starting in the mid-1990s with regard to medical cannabis, and in 2012 with adult use cannabis, states began to push back against the system of prohibition. Next slide, Dylan. Here's a landscape of the current cannabis laws in the US. The dark green represents states that have legalized for adult use cannabis. The lighter green states are ones that have legalized for medical cannabis. And as the chairman stated at the outset, 18 states have legalized, plus DC, and 2 territories have legalized for adult use. And 36 states have legalized medical cannabis. This has come largely through ballot initiatives, but increasingly over the past several years, both medical and adult use systems have been approved by legislatures. Most recently, the adult use system was approved in Connecticut via their legislature and a governor's signature. And increasingly, as I mentioned, that is the route that is being taken, in part because the United States is running out of states with the ballot initiative process to approve these systems, and the required process is through the legislature. But legislators across the United States are waking up to the failures of the drug war and the desire to have a different system in place. Next slide, Dylan. What's been most remarkable about the transformation of policy around adult use cannabis has been its speed. In Colorado and Washington in 2012, the voters in those states went to the ballot box to vote on referenda to approve adult use cannabis. Those were the first states to do so. And in those first few years, 4 states plus DC voted to legalize cannabis. The pace of legalization ramped up quite significantly after that. In less than 5 years, between November 2016 and June 2021, 15 more states legalized for adult use. The effort became a bit contagious, largely because legislators from a variety of states and voters from a variety of states recognized the failures of the drug war, recognized the racism that was built into our nation's drug laws, recognized that they believed cannabis was not as harmful as the federal government and other groups made it out to be, and wanted to try a different system. And right now, as we speak, almost 150 million Americans live in states that have legalized cannabis for adult use, which is about 44% of the US population. And it's a variety, a diversity of states that have chosen to do this, as I note here. Swing states, blue states, red states. It is not a politically controversial issue in a lot of places, and it doesn't require simply being a liberal state or a libertarian state in order to get this passed. This is something that American voters and state legislators from across the political spectrum see as an opportunity and a necessity to correct some of the wrongs that we have seen in public policy over the past century with regard to drug laws and cannabis specifically. The question arises, though, next slide, Dylan. I have a few blank slides in here while I'll be talking before we jump into additional slides as well. One of the questions that often pops up, one of the questions that I'm often asked is, why does a state legalize? What is the reasoning, the political reasoning, the policy reasoning for why a state takes that step toward legalizing adult use cannabis? And the answer is a complex one. And as each of you know, as elected officials, the reason why an individual voter votes for you may be very different than the reason an individual voter across the street from that person decides to vote for you. The political choices that Americans make come from a variety of sources, and that's particularly true for issues around cannabis reform. Some people approve it because they believe in individual freedom to make those choices over the use of drugs. Some people do it because they see regulation in a legal cannabis system as a means of advancing product safety. Some argue that black market displacement is a real goal, to say if we begin to produce this legally, tax it, regulate it, sell it at dispensaries, it will begin to displace some of the illegal dealers who are typically selling not just cannabis, but other substances as well. Others argue that it's an important step to reverse the harms of the war on drugs, which I talked about a bit previously. We can put the presentation back up, Dylan, and advance to the next. This issue is particularly true. I mean, it's true across the United States, but it's particularly true in Maryland. So here's a bit of data about the disparate impact and the broader impact of cannabis prohibition in Maryland. Even though Maryland has decriminalized cannabis, the use of the criminal justice system and public safety officials to advance cannabis laws still exists. In 2019, nearly 15,000 Marylanders were arrested for cannabis possession. And that racial disparity between Black and white Marylanders is significant. Now, it is below the national average. The national average is that 3.6 times more Black Americans than white Americans are arrested for cannabis-related offenses. In Maryland, that disparity is 2.2, but it still means that despite usage rates being about equal between whites and non-whites, Black Marylanders endure quite a bit additional suffering at the hands of the criminal justice system with regard to cannabis than white Marylanders do. And what was staggering to me in going through that same ACLU report was that 3 Maryland counties were among the top 10 counties, the top 9 counties nationally in terms of cannabis arrests per capita. In these 3 counties, more than 1 in 100 residents there are cannabis arrests that equal more than 1 in 100 residents in a year, and that year being 2018. So the impact of the war on drugs is significant in Maryland. It's significant not just in minority neighborhoods, but it impacts all Marylanders in a pretty significant way. That has spurred another aspect of reasoning for voters to advance cannabis reform, and that's racial justice and equity. This is a big part of our national conversation right now. It's a big part of local conversations. It extends beyond the war on drugs when we're discussing issues of racial equity. But the war on drugs and really the war on cannabis specifically sits at the heart of the ability of a system to persecute by prosecuting particularly people of color in creating the types of racial inequities that we see institutionalized throughout the United States. Aside from the aspects around race, there are 2 other reasons that individuals tend to move in favor of cannabis reform, and that's business opportunity and tax revenue. The latter, tax revenue, I prefer to not pay as much attention to. I think there are groups of advocates, and there are certainly a lot of legislators, I won't say necessarily in the Maryland General Assembly, but I've definitely seen it in other states, who overemphasize the amount of tax revenue that will come into a state. It is true that significant amounts of tax revenue come into the coffers of states that have legalized cannabis, but it is not a level of tax revenue that will reverse budget deficits, that will build schools across the state of Maryland, that will fill in all the potholes in the state and magically cure all of the state's budget woes. But it is a significant portion of revenue that is an important conversation, but should not be a driving part of it. Legalization systems throughout the. Part of that focus is on the ways in which systems get up and running, but there have been changes over time in the way that those systems are administered. So initially, the focus of regulatory systems were on business growth and employment. That is getting systems up and running, getting the businesses going, making sure people are hired, making sure that the regulatory system is in place to make sure that those businesses are able to operate within the bounds of the rules that the state sets out, and in a lot of places, the rules that both counties and municipalities will set out. A huge and important goal early on in the experiment around cannabis legalization focused on product safety, the security of both product and the facilities either growing or selling those products, and product testing for things like potency and adulterants as well. Those systems in themselves struggled a bit at first to get up and running and to get perfected, particularly in the initial states that got this going. But over time, states have gotten much better in terms of finding the right type of regulatory and legislative language to make sure that the products being produced from a legal system are safe, and that the consumers know exactly what they're getting when they go into a dispensary to purchase cannabis, to purchase legal cannabis. Also, initially, the systems focused on preventing youth use, an important and ongoing part of this, these systems, and certainly one that I know the Maryland General Assembly is particularly focused on as it decides whether or not to move forward with adult use legalization. And finally, and as I mentioned before, displacing the black market is an important part, was an important part of those systems early on. But over time, the goals of the system, the goals of adult use cannabis systems, either that were already approved or being prepared to be approved, changed a bit. Many of those existing or early goals remained intact, but the conversation changed. And what I consider the driving force of the cannabis legalization conversation in the states right now focuses around racial justice and equity. A lot of advocates rightly looked at the systems early on in Colorado, in Washington, in Oregon, and Alaska, and recognized that the individuals who suffered most during the war on drugs were not seeing the benefits of legalization, not seeing the benefits of dismantling the drug war apparatus. And so steps were taken to elevate that part of the conversation and to try to get more opportunity and more reinvestment into the communities harmed by the war on drugs. Concurrent with that was a focus on criminal justice reform. A lot of individuals argued that if we are going to declare that cannabis is no longer illegal, the question arose whether states should take the steps to expunge the records of individuals and to help ameliorate those types of targeted arrests that we know happen across the country over the course of decades during the war on drugs. At the same time, as I mentioned, issues around business growth, employment, product safety, labeling, access to the product, et cetera, remain an important part of the cannabis legalization conversation. And increasingly, innovation is a big part of it too. How can technology, how can what we've learned from other states, how can business to business communication build a more innovative, safe, better regulated system? And how can states do a better job to both lower regulatory costs without lowering the types of protections that those regulations seek to advance? So that is generally what the core of the cannabis conversation has been and continues to be moving forward. And I know, as I mentioned, and as the chairman mentioned, a lot of these issues, particularly around youth use, product safety, racial justice and equity, are the driving forces behind the effort in Maryland to take this step and consider adult use legalization. Next slide, Dylan. And one more. So I'm going to talk a little bit about what we've seen in terms of the experience in states so far. And I'm going to compare Colorado and Maryland for a couple of reasons. First, Colorado is an ideal candidate because we have the most data coming out of Colorado. Colorado and Washington state legalized on the same day, election day 2012. Colorado's system got up and running about 7 months before Washington's system did. And because of that, we now have a larger data set from Colorado than we do any other state on the effects and the impacts of legalization. At the same time, Colorado and Maryland are fairly similar in size. They have somewhat similar levels of diversity in the state, although the non-white groups in Colorado do tend to vary in terms of totals and percentages compared to the non-white groups in Maryland. And one difference that I think I should note, and it's important to note, is that Coloradans historically and currently tend to use cannabis at higher levels than the average Marylander does. Those are fairly significant differences, as you can see on the screen, between past month and past year cannabis use in Maryland versus Colorado. And those are important aspects to consider and think about when you're thinking about the size of the Maryland market. Because Maryland and Colorado are similar in size does not necessarily mean that the markets will reflect the same, because you have to factor in a variety of issues, but standing use is certainly going to be one of them. Next slide. The experience in the states has been significant, particularly around economic impact. The cannabis industry is one of the fastest growing industries in the United States. In some places, it's one of the fastest growing industries around the world. And the impact of the economic impact of it is sizable. There's a direct economic impact, that is, how many people is the cannabis industry employing? What types of revenue is it growing? And you can see here the Colorado cannabis sales revenue from 2014 to through at least June of 2021. That is, those numbers are not cumulative. Those are yearly numbers. So far, Colorado has sold about $11.5 billion in cannabis since sales began, adult use legal sales began January 1st, 2014. And those numbers, as you can see, are growing year over year. And the projections for 2021 is that they'll outpace 2020 as well. But in addition to the direct economic impact, there are a lot of secondary and tertiary industries that help support the cannabis industry as well. People need to build dispensaries and build grow operations. People need to provide services like legal counsel, accounting, and other services that just make a business run. And so what you see here is the direct sales revenue. Again, I caution not to have as much focus on tax revenue, but sales revenue. But the revenue that the cannabis industry produces, like any other industry, has multiplier effects as they both employ people directly, but rely on the services of other industries as well. That employment growth is significant. Projections are that tens of thousands of individuals, hundreds of thousands of individuals can be employed in a fully functioning cannabis industry, and that employment impact is significant, particularly as we come out of a recession. And individuals in the cannabis industry oftentimes are younger, are diverse, and represent the types of groups who oftentimes struggle in the labor market, particularly as we come out of economic downturns. And as I mentioned before, tax and fee revenue is significant. It's not a cure-all, but it will mean some significant amount of additional money into the tax coffers of the state of Maryland that otherwise would have been wrapped up in a black market where no taxation is being drawn from it. In addition to the economic experience in the states, there's also been an experience. You can advance to the blank slide, Dylan. There's, as I mentioned earlier, an increase in addressing racial justice and equity. And this has happened in multiple ways across multiple states. And Illinois, New York, New Jersey, other states have really focused on a three-pronged approach to dealing with issues of racial justice and equity. The first is record expungement for low-level, nonviolent cannabis-related offenses. That is, individuals who have been convicted of crimes in the state of Maryland or are currently in jail awaiting trial or awaiting some sort of dispensation of their case. will qualify for some sort of record expungement, whether it's through the pardon power of a governor or whether it's through an actual legal process of expungement. That's an important step, again, to reverse the effects of the war on drugs and to recognize that the laws that were in place for decades were not just discriminatory, but they were devastating for many individuals and the communities from which they hail. The next step, the next part of the focus on racial justice and equity is providing ownership and investment opportunities for people of color. In some states, there's a focus on communities of color generally. In some states, there's a focus on individuals who have past convictions for cannabis-related offenses. The reality that I think not many people often think about is if you've been convicted of a low-level cannabis crime in the past, there's a chance that you know more about the cannabis business than a lot of people who are coming to it knew for the first time. And so in an odd way, the presence of a prior conviction can show a real knowledge about how that industry would work, how that plant is grown. And while some states early on took the step of banning any individuals with past cannabis convictions from even working in the industry, states are starting to think differently about both employment as well as ownership and investment opportunities in the industry for those directly affected by the war on drugs. And the final step, the final part of the racial justice and equity conversation that we've seen in new states that have approved their programs, as well as states that approved them previously and went back and made changes to their systems, is investment in the communities most impacted by the war on drugs. And that's broad-based investment, not so much, not focused specifically on issues like criminal justice reform, but investing in education, investing in community centers, investing in individuals themselves, childcare, workforce training, et cetera, recognizing that the war on drugs affected both individuals, and as I've written in the past, has affected the families and the communities around them, even for individuals not directly facing a cannabis arrest or conviction. And it's an important two-part process between investment in communities and record expungement. What I often say is that record expungement improves one day in a person's life. That is the day that they've faced conviction for a cannabis-related offense. It doesn't affect all of the days that followed that conviction, where that conviction and that record followed them along and cut them off from educational opportunities, employment opportunities, and other types of social opportunities. And so that community reinvestment is really an important part of a more holistic approach to improving the individuals and the communities harmed most by the war on drugs. We can go back to the presentation. Dylan? So I'm going to talk a little bit about the effects of cannabis legalization within the states. And there are a lot of issues that individuals think about and worry about when it comes to legalizing cannabis. One of them is what happens to cannabis use, just flat cannabis use. So this is a chart from Colorado that shows past individuals' use in the past 30 days of cannabis from 2014 to 2019. As an indicator, 2014 was the first year that adult use cannabis was legal in Colorado for purchase. And as we see early on, there was a fairly stable level of cannabis use over the first few years that has since elevated. And the numbers from 2019 are statistically significantly higher than the early years of legalization in the state. So there's no denying that those numbers are showing, the reported numbers have increased. But of course, when a product is legal, more people are likely going to be interested in using it. Now, not everyone in Colorado is using cannabis, not everyone is using it every day, not everyone is using it every month, but we have evidence that there has been some marginal increase in use in the state of Colorado. Now, it's important to take this into in context as well. This is self-reported use of cannabis in Colorado. And so while I personally believe that there has been a slight increase in use in Colorado since legalization, it's important to recognize that individuals are much more likely to admit to using a product that is legal than to have admitted to using a product that is not legal or was previously illegal. And so those effects likely mute the true effects of the increase of cannabis use in that state. But again, we would expect that there would be some increase in that use. It's also important to focus on who those increases are among, and I'm going to talk about youth use shortly. But what we found is that in Colorado, at least, use among the 18 to 25 demographic has stayed fairly flat from pre-legalization to post-legalization. It turns out that older Coloradans tend to be the ones who have seen increases in use post-legalization. The fastest growing group of users in Colorado, and there's some evidence that this is true in other states as well, is individuals over 50, and particularly women over 50, who typically had lower than average levels of use of cannabis pre-legalization and are more willing to try cannabis now that it's legal in their jurisdictions. There's questions too about what happens to the black market in Colorado. And I think combining both this slide on the marginal increases in cannabis use with the revenue numbers that we saw in a previous slide shows that in states that have legalized, there is some displacement of the black market. I'll be the first to tell you that legalizing cannabis in Maryland will not get rid of the entirety of the illegal market in the state of Maryland. But when you have a state like Colorado that over the course of 6 or 7 years sells $11.5 billion worth of legal cannabis, and we know that individual use has only gone up slightly, you have to assume that that increase in use does not account for the entirety of that market. And so Coloradans are turning to the legal market in a way that was not available to them previously. And instead, they are displacing some of the illicit sales that existed, and likely a significant part of the illicit sales that existed previously. Next slide. So youth use, as I mentioned, is an important part of this conversation, and I'm going to talk a bit about what the data tell us about youth use, and then I'll offer some conclusions about youth use as well. What we see here is high school students past 30 days marijuana use in Colorado from 2005 to 2019. So the 2015 mark is the first year that we have legal, the first year we have data on this chart where legal cannabis sales were happening in Colorado. What we see, and the blue line is Colorado and the orange line is the national level. What we see is that the patterns tend to follow fairly closely Colorado and the national trend. The 2015, 2017, and 2019 numbers would suggest that those track fairly closely. They track together. The percentages are similar for high school students' past month use. And what these data suggest is that cannabis legalization in Colorado did not lead to a spike in high school students' past month use. That's an important lesson to take away because there are advocates who oppose cannabis legalization who argued pre-legalization in some states like Colorado and continue to argue that legalization simply puts more cannabis in the hands of young people. What we found in most places is that is not the case. Now that doesn't happen automatically. That doesn't happen on its own. That happens because states take a concerted effort to make sure that there are educational campaigns in place to help prevent youth use, that compliance checks are happening at dispensaries to make sure that dispensaries are not selling to underage individuals. And so this is an effort that I think is important to focus on, in part because of the importance of it to the legislature and to a lot of Marylanders, but in part because a state should not rest on its laurels that legalization does not automatically lead to an increase in youth use. It is an active goal that must be pursued continuously post-legalization to make sure that those numbers stay as low as possible and that legalization system does not increase that use. Next slide. This shows youth use, again, in Colorado, among Colorado high school students over the same period of time, among a variety of substances. The gray line, the light gray line is cannabis use, which shows from 2005 to 2019, again, a fairly stable level of cannabis use, pre-legalization as well as post-legalization as well. Next slide. Another important part of the conversation in a lot of states surrounds traffic safety. The concern exists that if cannabis becomes legal, that a lot of people are going to be consuming cannabis, getting high, and then going out and driving and causing car crashes, causing automobile and pedestrian fatalities. And I think that's an important, legitimate concern that any lawmaker and any voter should have. There are steps that states that have legalized put into place to improve traffic safety, to improve awareness, to make sure that people are not getting high and driving. And so I felt it important to put out numbers that show what has happened in Colorado in terms of the number of fatalities in accidents with drivers who have tested with THC levels higher than 5 nanograms per milliliter, which in a lot of states is considered the level of impairment. And it shows that from 2016 to 2019, there were ebbs and flows in terms of the number of fatalities. It's important to recognize that any death on the roads related to cannabis use is an unfortunate one. But at the same time, there is a lot of debate and controversy, particularly in the medical and scientific communities, about whether 5 nanograms per milliliter actually indicates impairment. And so medical science is trying to work harder and do better in terms of devising a test and a system that will identify impairment, much in the same way that we have levels of blood alcohol content, that we have pretty valid evidence represents impairment. We just don't have that yet when it comes to cannabis in the same way. But again, it's important to guard against increases in numbers in traffic fatalities and traffic accidents where a driver did have cannabis, particularly active THC in their system. At the same time, when we're looking at the number of fatalities on Colorado's roads, which the bottom part shows, as well as the number of drivers tested, we see a couple of things. From 2016 to 2019, there were similar ebbs and flows in terms of the number of fatalities on Colorado's roads. And so the number of fatalities with a driver who tested positive for THC doesn't necessarily outpace what was happening generally on Colorado's roads. But we also know that there are increases in testing happening, particularly increases in testing happening THC. And so when that happens, if you're testing more people, the likelihood of finding more incidences of individuals with THC in their system is going to be higher. And the Cato Institute conducted a study in 2021 that looked at the literature that actually found very little evidence in the relationship between legalization and the number of traffic fatalities related to drivers testing positive for THC in those states. But again, this is an issue. This is a type of data that should not allow a state to rest on its laurels. It should focus on prevention of traffic fatalities, most importantly, prevention of driving while high or driving after using cannabis in a way that protects Maryland roads in the same way that Coloradans and Californians and Alaskans and nutmeggers have put into place systems to do exactly the same as those states have chosen to legalize cannabis. Next slide. I talked a bit about the Cato study a moment ago, and I can forward the study along to the work group after my presentation ends, after today's hearing ends. It's a very comprehensive study that looks at the relationship between legalization and a variety of issues that are important to state legislators. I note a few of them here: increases in the relationship between legalization and increases in youth suicide. They do look at youth use as well. Traffic fatalities, above existing state trends or above the national trend, decreases in youth IQ, and significant increases in youth crime. The Cato study finds limited or no relationship between legalization and each of those, suggesting that, the doomsday predictions of some end up not panning out in those states. It doesn't diminish the importance of focusing on these issues and making sure that there are public policies in place and campaigns in place to try to deal with these issues. But one of the important points that the Cato study makes, a lot of other studies make, I make in my own work, is that there's oftentimes difficulty in identifying causal relationships. That is, if we see increases in certain types of data, for instance, if we see an increase in the relationship between youth use of cannabis and the presence of, let's say, schizophrenia or other types of mental health disorders, what medical science has shown us and what social science has shown us is that there's not a clear understanding of whether individuals who are predisposed or already experiencing symptoms of mental illness turn to cannabis as a therapy. And that results in that those numbers being correlated, or whether there is actually a causal effect going on. And so I think anyone who will tell you with certitude that cannabis is causing X when it comes to a certain type of mental illness or the experience of mental health symptoms or other types of issues is oftentimes not putting data into the proper context, not looking at existing state trends, at national trends, or the causal direction of those relationships. It's also a challenge, and I've spoken to the Maryland legislature before on this issue in particular. There are challenges in terms of the limitations of data and data availability. I think it is incumbent upon the state of Maryland and any state considering legalization to think about the types of data and information that they want to know about their state when it comes to the impacts of legalization, and begin collecting those data before legalization takes effect, so you have a baseline indicator of whether there have been increases. So if you begin collecting on youth use, youth suicides, experiences of youths having mental health disorders, et cetera, you want to know whether post-legalization those numbers were increasing, or whether they were already increasing, or whether the baseline is fairly similar to what the numbers look like post-legalization. And the only way to have a good, solid, data-driven understanding of those trends is to collect those data in advance and have those baselines in advance. Next slide, Dylan. Okay, we've got a placeholder. Just going to take a little sip of water. Mr. Chairman, as you said, this is the first hearing you've done in quite a long time like this. It's also the first time I'm talking for this long in quite some time like this. So I apologize for being a bit hoarse.
Well, why don't we do this? Then we'll make a little bit of a call here, and I'll give you a couple seconds to take another drink of water, because I can filibuster with the best of them. And if there are any members of the committee who have a quick question as to what the doctor has said up until now, we might take a couple questions from a little bit of a break here, and then we'll come back for a few more. I see Vice Chair Dumais, and then we'll go to Delegate Wilson. Vice Chair Dumais.
Thank you, Mr. Chairman. I actually have two questions. One, in relation to the information and data that you provided regarding testing in when there have been fatalities or deaths. Is in Maryland, we were only able to test for substance if there has in fact been a fatality. Is that the same? And by testing, I mean draw blood. We cannot do that if there's simply a suspicion and whether there's been an accident or somebody's been pulled over. Is that the same? Or is the data that has been collected the same, that it is based on blood draws?
Yeah, so for THC, yes, it's based on blood draws. I think, Madam Vice Chair, you hit on an important point. When you're looking from state to state at the data that they have, oftentimes you can't compare apples to apples because the rules that govern issues of search and seizure, particularly when it comes to specimens. In one state, those rules might be different in another state, depending on legislation, depending on common law, et cetera. And so in some states, you can draw blood or have a urine test, et cetera, with suspicion, or in car accidents that are non-fatal car accidents. But as you mentioned, in some states, those rules are not the same. So it's important when you're looking at traffic fatality and traffic accident data to recognize and understand the underlying rules within that state when you're comparing it with the data that you have in Maryland.
Okay, because we are pretty strict. And then my second question, which if the chair would like it to wait, I'm fine. But my second question would be if you could talk a little bit about the effect of legalizing for adult recreational use in states where medical marijuana is legal, and sort of what happens when the adult recreational use is legalized.
Sure.
And
You didn't talk about that before, so if the chairman wants to wait a minute, I'm fine, but.
Yeah, and I should have said that since I've called an audible here and let him take a little bit of a break here. If there are issues that are being raised in questions here that you're going to touch on in the next part, then we'll just let you take those into the next part. And if people still have questions, we'll still take questions after that.
Sure, I'll do that. Madam Vice Chair, that question I don't have in the remainder of my remarks, so I'd like to answer it now. It's an important question. It's also a very important concern among medical patients in states, whether the approval of an adult use system will in some way harm A, their ability to have access to cannabis, and B, whether it will affect the price of cannabis for those individuals, and especially for individuals with very serious health conditions, which a lot of Marylanders rely on the existing medical cannabis system for that. Like I said, it's an important point. So far, every state that has legalized adult use cannabis has had some existing medical cannabis system in place. The exception, or the closest to an exception I think you would have, is Virginia, which had a very rudimentary medical cannabis system in place when it this year approved adult use cannabis. In all of the other systems, generally, we have seen the medical system continue operating as usual. Washington State is the exception. They've had a unified and consolidated system that has caused some supply interruptions. There are a lot of complaints among Washington State's medical patients about what the legalization system has meant for that state. Generally, in states that have medical cannabis systems, the tax rates are significantly lower for medical patients than they would be for the adult use market. There are also typically early on, and I think this is a very important part for adult use legalization, early on, there are protections in place so that all of the supply does not then go to the adult use market, and that patients are then not shorted. I wish I could tell you that those systems so far have been perfect in terms of protecting that type of supply. They have not been in every state. But it's not to say they can't be in a state like Maryland, but it is a critical issue, particularly because you have HIV/AIDS patients, cancer patients enduring chemotherapy, pediatric patients with very serious illnesses, and ALS, MS patients who really depend on this to make sure that that supply is uninterrupted and that the prices of medical cannabis do not increase significantly. Because even if you have lower tax rates, if you have a higher price, the tax you have to pay is higher, plus the base price is higher. And so those are all important factors that I think any new system needs to think through.
Okay. Thank you.
Thank you.
All right, Delegate Wilson, then Delegate Barnes.
Thank you, Mr. Chair. I have about 6 questions, but I'll just try for 2 and I'll wait. Hopefully you'll cover some of the other areas, but I'm just trying to go over the things you've already covered. You spoke firstly about the black market. And I've done some studies at the Colorado black market. One thing you kind of address is it's driven, I think, partially because of how expensive legal marijuana becomes. And not if you don't control your prices, you actually can cause the black market to thrive. But more concerned with your point about how you talk about expunging cannabis-related convictions. But to my understanding, I want to be clear, it's still a felony in Colorado to sell marijuana. Actually now enforced more than before, because now you're messing with people's money and taxes. So we're not going to be, in Colorado hasn't expunged any of the selling, any of the African Americans who are selling to make a living or because that's the only way out of the hood. There's no state that expunges the selling or distribution of marijuana, correct?
So, Delegate Wilson, your question about prices, the first part of your question about prices, I will address in the next section of my talk, and so I'll hold off on that one. But you raised a very important point about the types of crimes for which record expungement happens. And you're right, in a lot of jurisdictions, the sale of cannabis, even the small scale sale of cannabis, is not eligible for expungement. And that creates a situation, like you said, where you have individuals, particularly in urban areas, particularly people of color, young Black men in particular, who see the sale of cannabis under prohibition as a means of having revenue, supporting a family, et cetera. And they can get caught in a system of record expungement where they are left behind. And I think having that conversation, particularly in a state that has a large urban center like Baltimore, to have that conversation about what would qualify and the conditions under which it would qualify is important. I think there are very few people in the United States who would want to expunge the record of, someone who has 3,000 pounds of cannabis and they're distributing it out to a network. But if you're caught with a small amount of cannabis for sale, or what could be considered a reasonable amount of cannabis for sale, and you're not a trafficker, I think there's a legitimate argument to be made that extending expungement policy to include those individuals is an important reflection of the realities on the ground in certain communities, and the types of perceptions of harm that those individuals might be creating or not creating within those communities.
And I appreciate that, but just to piggyback on that answer, but in every jurisdiction where recreational marijuana is legal, it is still a felony to sell even small amounts of marijuana without a proper license.
Yeah, so I'm not, I can't say that for sure. I haven't looked at every state's laws. I mean, if you have, I will certainly take your word for it. But it does make sense. I mean, it's not to say that in every state, expungement policy is not necessarily extended to individuals who are selling small amounts. But you're right that in a lot of jurisdictions, that is a felony, and it is ineligible. It is also ineligible for expungement.
And my brief second question is, again, I hear a lot of individuals, especially proponents of legalizing recreational cannabis, talk about racial justice. But in Colorado, since you compared Colorado to Maryland, of the growers and the growers' licenses, what percentage of those are actually delved out to the African Americans who, as you said, were most harmed by this? Because it seems that we talk about a racial injustice only on a criminal, but not on the financial equity. And like we have in Maryland, we have 15 growers' license. One is owned by an African American. And I don't believe there's a way to get equity that quickly unless we were to get the others up to speed. Do you have the answer to about the balance of Maryland, in Colorado, as far as trying to get that equity? Did they do something to ensure African Americans would have those growers license, not distribution, not the low level, not the crumbs, but the actual growers licenses? Yeah,
so I don't have the most updated numbers from Colorado. What I will tell you is that typically ownership in the grow space for Black and Brown Americans in legal states tends to be less than 5%. Right. And so your experience in Maryland, in the Maryland medical system with ownership, is fairly reflective of what that situation is in other states. Colorado is an interesting example of what a state can do to make changes. So initially in Colorado, there were not effective systems in place to help Black and Latino Coloradans to have access to ownership of dispensaries or to grows. They've since created programs to increase that type of diversity in the industry. But there's a problem there. in most new industries, there's first mover advantages.
Amen.
And so the Colorado system is already mature. And so the ability of poorer, less capitalized Black and brown individuals in Colorado to break into a mature market is minuscule. It's already hard enough to get these businesses to continue running. It's damn near impossible to get them running once that market is mature. And so in a state like Maryland, doing it from the outset is essential to have any chance at success of diversity and ownership in dispensaries and grows.
Exactly. Thank you very much. I'll hold my other question, but that's exactly what I was getting to. Thank you.
Thank you.
All right, again, on asking questions as to what the doctor has already spoken about. So let's keep limited to that, which we've done so far, and that's fine. I'm not picking on anybody. Delegate Barnes, then Vice Chair Pena-Melnick, and then we'll go from there. Delegate Barnes.
Thank you, Mr. Chairman. And I must say, Delegate Wilson was definitely in my head when he was talking or referencing the black market. And Dr. Hudak, I appreciate your remarks today. You know, as I sit here and looking at what we are contemplating here in the state of Maryland, concerns me from your conversations where you stated 2.2% Black Marylanders are more likely to be arrested because of cannabis. And we are ninth in the nation with 3 Maryland counties in Worcester, Dorchester, and Calvert in cannabis arrests. And in 2019, nearly 15,000 Marylanders were arrested because of cannabis possession. If we legalize cannabis in the state of Maryland, what do you think will change?
It's an important point, and also one that I don't discuss in the rest of my remarks. So I'm happy to take that question, Delegate Barnes. You're right. Black Marylanders are 2.2 times more likely than white Marylanders to be arrested for cannabis, even when controlling for differences in the populations. Simply legalizing cannabis, what we found in other states is that it dramatically decreases the number of cannabis arrests in the state. It makes sense. If possession is if possession is now legal, fewer people are going to get arrested for cannabis possession. But what we found, what the ACLU in particular has found, is that those racial disparities endure. In some places, they get worse. And so while the sheer number of Black Coloradans or Black Californians who are arrested for cannabis decrease, those disparities still endure. So Blacks are disproportionately more likely to be arrested than whites for existing cannabis offenses. And so part of that conversation, part of that reform also has to include work within law enforcement agencies, work on policing, work on community policing, work on issues that I know this legislature is taking up in the context of police reform in a variety of areas beyond drug policy. But there's no better place to have that conversation than in a conversation around marijuana legalization, because we know that those disparities still endure. And so, yes, it'll be great if there's a 90% decrease in the number of arrests in Maryland post-legalization for cannabis, but there's no excuse for those racial disparities to endure. And so it's something cultural, it's something community-based, and it's something that needs reform as much as cannabis needs reform.
I appreciate that. And Mr. Chairman, my last question, and it goes back to, once again, part of the conversation that Delegate Wilkins had brought up, and that was in regards to equity within the cannabis industry for here in the state of Maryland. Do you know the numbers of equity ownership, not only in Colorado, but other states, or those that are able to invest that may have been incarcerated for low levels of marijuana?
So in terms of access to ownership opportunities for those who were previously incarcerated, I do not have those data in front of me, Delegate Barnes. I will tell you that I I have not heard many stories. I have not seen data sources on a lot of individuals who are previously incarcerated who have ownership opportunities. There are multiple layers of discrimination that harm individuals from those backgrounds in terms of having those ownership opportunities. Simply having a program in place that allows someone who's previously incarcerated to have the ability to apply for a license is one thing. But when we think about the challenges that the previously incarcerated face in terms of their own employment, wealth accumulation, ability to have access to capital, these are structural barriers that exist that simply allowing the ability to apply for a license does not fix. So it requires a multi-part, multi-pronged, systematic effort to help individuals who are previously incarcerated, as well as people of color who are not previously incarcerated, who oftentimes face those same systematic barriers to wealth accumulation and access to capital. And so a system must be built that recognizes those discriminatory and institutionalized barriers and helps individuals who have a genuine interest in ownership in the cannabis industry to be able to overcome them. Like I said, not just in terms of applying for a license, but in terms of being able to open, build, and thrive in that industry.
Thank you. Thank you, Mr. Chairman.
Okay, we'll go to the Vice Chair, Delegate Pena Melnick. Then we'll go to Delegate Moon, and then we'll have Dr. Hudak start up with the second part of his presentation.
Thank you, Mr. Chairman, and good afternoon, Doctor. It's great to listen to you. While the study also found limited or no relationship between legalization and increased risk of youth suicide, traffic fatalities, decrease of youth IQ, or significant increase in violent crime, this included the caveat that I thought was interesting that said it was difficult to identify causal relationships due to limitations of data and data availability. So my question is, what are those limitations on data and data availability? And can they be rectified? And can these numbers still be considered accurate given that caveat?
Thank you for that question. I'll say there are a variety of data limitations. One of them from a medical side. So when you're dealing with public health issues, youth suicide, youth addiction, or I should say youth dependence, things like that, it's often the route to understanding the causal relationship would require a type of double-blind clinical study that understands why individuals are being moved to use or whether they're using and it's actually creating the types of medical outcomes that we ultimately observe. Observational studies make it much harder to identify that. So in the medical context, those data limitations are very difficult to overcome. At the same time, in terms of public safety or other types of data, the biggest limitation is not having that baseline data that I had mentioned before, understanding what those data look like pre-legalization, or even if you have the data, if you are collecting data pre-legalization, one of the challenges is oftentimes not having those data collected in exactly the way that you are going to want to analyze those data post-legalization. And so that is the opportunity to rectify the challenge. There's the opportunity to discuss with the relevant agencies in the state of Maryland, ask them simple questions like, if we legalize in Maryland, what data, what indicators does your agency deal with that you will be interested in seeing whether there's an impact on legalization? How would you design that study? And are you currently collecting data in a way that will allow you to analyze properly and conduct a study properly post-legalization? If the answer is no, then they should begin to collect those data in different ways or begin collecting additional data that will assist in that type of analysis. In states that don't do that, it's much harder, if not impossible, to measure the effect of legalization relative to data pre-legalization. And all you could then identify is what is happening post-legalization from year to year. And those data are not useless. You know, if let's say let's say Maryland legalizes this year and the system gets up and running in 2022. If you see the data on youth use stable in 2023 and 24, and then all of a sudden there's a spike in 2025 and 2026, well, you know there's a spike, right? And then you're going to have some public policy response to do that. But the importance of understanding the effects of legalization requires valid, reliable, and accurate data pre-legalization to make that comparison. And Maryland is in a position to start to collect those data in the right ways now, in a way that for a place like Colorado or Washington, it's too late because they've already passed their systems and they're up and running.
Thank you so much for your answer. Thank you, Mr. Chairman.
Thank you.
Delegate Moon.
Thank you, Mr. Chair. Well, thank you for this presentation, and obviously thank you for pointing out some of the failures of the drug war regulation model. Since this is an organizational meeting, I have a question for you that is also sort of a flag for my work group colleagues. And here it is. What trends, if any, can you discern for how long a state takes to actually get rid of the crimes on their books after they've taken a vote? And I say this because the timeline has been outlined at the beginning of this meeting seems to imply a legalization date beyond 2023, which for someone who cares about getting rid of these stupid crimes seems like an entirely long time. And so I've heard possibility of self-executing provisions and referenda, things of that nature. I think Virginia had an extended delay, and then the governor made them come back and at least get rid of the crime immediately. So I just want to flag this variable and see if you've seen anything for how states are beginning to approach this.
So Delegate Moon, thanks for the question. There's a few parts to this question. The simple answer is that it's a bit all over the place. Some states do this more efficiently. I think Virginia is a good example of that. Other states take quite a bit longer to do this. In part, and frankly, some states didn't do it at all out of the gate. And so to be able to provide a real average timeline would be difficult. It also ends up being process oriented. So record expungement in the states, and all of the states that have taken this on so far, has not been the flip of a switch. It has been a process over time. In a state like California, individuals needed to petition local district attorneys or judges to have their record expungement happen. In a state like Illinois, that record expungement was automatic, and it was done in part through district attorneys compiling the information, delivering it to the governor or delivering it to courts for that record expungement to happen or for a pardon to happen. Those are, again, process-oriented issues. But I'll give you an example that I heard from the chief regulator in Illinois about the challenge that exists in the system, and a challenge that I'm not sure if Maryland is ready for, or if those challenges exist, but something to consider. So in Cook County, where Chicago sits, a lot of the conviction records were paper-based. Even still, even once legalization happened a few years ago. And so the ability to simply search in a computer for all of these convictions, get a list of the individuals who would qualify, and then submit that list to courts or to the governor was limited because the paper system had to be digitized, which naturally dragged that process out. And Illinois was innovative about it. They got nonprofits and for-profit organizations together to have people who were able to code programs that would be able to make the system work more efficiently. But it was still a slow process, and much slower than the legislators who worked on it wanted to happen. And so in addition to there being legislative and judicial barriers to it, sometimes there are functional barriers that in some ways were a surprise to the state legislators who were working on it, because those state legislators just weren't familiar with the criminal conviction record keeping systems of Cook County. And if you think about in a state with a county-based system of judicial process, if a place like Cook County is not up and modernized. You can assume that more rural counties, less well-funded counties, are also going to be less likely to be digitized. And so those issues are important ones for states and county and municipal governments to consider, particularly around the issue of record expungement, because people's lives depend on this, people's futures, people's opportunity depends on it. And so getting it right through research on the back end will help be able to move that system along much quicker once the laws are passed and the system is in place.
Okay, thank you very much. We're going to move to the next part of the presentation after we allegedly gave Dr. Hubert a break. I'm not sure that we did, but we can get going with the next part. I do have a couple questions, but I'm going to wait so that we can get as much of this in as we can before 3 o'clock.
Sure. Thank you, Mr. Chairman. I don't have a significant portion left. I'm going to talk first about some continuing challenges that exist in the states, and we did touch on a few of these in this question period. And then I'll close with some final thoughts about lessons learned and things to think about as this group moves forward and as the legislature as a whole moves forward. Some of the continuing challenges that exist in the states that have legalized their systems we've touched on so far, and that's greater efforts to address past racial injustice is needed. Delegate Moon's question in particular, I think, is an important one that shows that when we have best laid plans, when we have a system to advance any type of issue, particularly an issue of racial justice, forward, but we don't have the institutional or administrative apparatus to put it into place, that policy is likely to fail at worst or be slowed significantly at best. And so as the state of Maryland moves forward with the consideration of legalization, understanding the administrative capacity of the systems that are going to be affected is an important foundation for making sure that legalization is successful. When it comes to racial justice issues, we know that no state has gotten it right. There's going to be a lot to be learned from the newer states that have come online and improved their systems. Illinois has been up and running for a couple of years, but the states that are brand new in terms of legalizing, particularly New York, New Jersey, Connecticut, and Virginia, have some of the most comprehensive racial justice and racial equity provisions built into them. Understanding and looking at the success or failure of those states in terms of being able to advance issues of racial justice is absolutely essential. And moving forward, especially connecting this to Delegate Wilson's question, more work needs to be done on racial disparities in both arrests and convictions. And the eligibility of individuals for record expungement, understanding not necessarily just the provision of the penal code for which they are penalized, but oftentimes the context in which their crime was committed, to understand what their role may have been in an illicit drug trade, and whether the legislature and whether the society as a whole within Maryland sees that as something that should or should not be eligible for record expungement. The next issue, the next category, I'll say, of continuing challenges within a state focuses on regulatory choices, tax policy, and licensing requirements. This ends up being one of the hardest areas for states, counties, and municipalities to get right. In a state like Maryland, state regulations are going to have to speak to county and municipal regulations. They're all going to have to come together in a unified way in order for businesses to get up and running. And one of the biggest challenges in some states, California being chief among them, were those intergovernmental disagreements or intergovernmental challenges of just simply not being on the same page. And the California system had a bit of a slow rollout because those intergovernmental bodies were not speaking to each other or lining up in the ways that were necessary. At the same time, the regulatory choices that a state makes have pros and cons. They have some competing interests. Obviously, Marylanders who are in favor of legalization want a safe, regulated system. But with each additional regulation comes costs, and those costs are passed on to the consumer at the price point. And so understanding the way to have efficient regulatory abilities to achieve the public policy goals that this system intends is important, because simply layering regulation upon regulation does have effects both for the consumer in terms of how much they're paying, for the producer in terms of their ability to be competitive, and for the ability of a legal system to displace the black market. If prices are relatively similar between the illicit and the legal market, a lot of consumers are going to go to the legal market. If the price of cannabis in the legal market is 3 times as much as an individual whose friend sells cannabis on the side, you can bet people are going to stay in the legal market, in the illicit market. And so understanding the connection between regulatory choices and costs and prices is absolutely essential. Delegate Wilson talked very convincingly about the challenges that exist for diversity and ownership. And I mentioned a bit of this in the answer to his question, and so I'm not going to dwell on it, but understanding that simply access to the application process for the license does not mean access to ownership or access to success in ownership, and being able to build a system that can guarantee all of that for individuals, particularly minority applicant individuals, is going to be critical. Another aspect that is increasing in the conversation at the state level and at the federal level involves firm size and the type of entrant into the industry. There have been bans in some states on investment from outside state investors, on ownership from individuals outside of the state. There are conversations at the federal level about banning ownership of companies that have legacy systems, such as alcohol and tobacco, because of some of the past harms that those industries perpetuated among youth, among people of color, and among really all Americans. And so the conversations around the types of limitations that you'll have for ownership and investment opportunities is critical to make sure that the system is functioning in the way that it looks like, in the way that it is intended, and that the legislature would want. I want to take one note, especially on the issue of legacy industries. We know that alcohol and tobacco in the past have had predatory advertising practices, predatory product production practices, and those have created very serious challenges for individuals. It has put lives at risk. It has made sure that young individuals became addicted to substances early in life, and that addiction and dependence continued over time. It's important too to remember that those involve more than just those types of firms. They involve certain behaviors coming out of those firms. And so while you're thinking about firm type and entrant type, it's also important to make sure that in conjunction with that, you're also creating a system where those types of predatory practices are banned, whether it's a large multi-state operator or a small mom and pop operator. Those predatory practices must be considered and must be excluded from a cannabis market. And I mentioned competitiveness as well earlier on, and it's an important point. Being able to make a system competitive for all entrants and not, or all business owners, and not just the largest operators, is going to be critical. And some states have done well at this, and other states have not. And the ability to compete, particularly for smaller firms, tends to disproportionately hurt owners of color, owners who are less capitalized. And so making sure that that system can serve as many business owners effectively and equally as possible is going to be important to make sure that the industry is diverse. And of course, there's a continued challenge. Another category is the continued challenge of making sure that public health and public safety is ensured. I have been to conferences where I have heard individuals stand on stage and say that cannabis isn't addictive, that it has no harms. I know no one in this room believes that to be true. Cannabis use disorder is real. It affects a subset of individuals who use cannabis. And recognizing this, making sure that funding is there to deal with mental health and addiction services, making sure that the types of practices from businesses are not capitalizing on heavy users. We know that in a lot of states, there's an 80-20 rule. That is 80% of the product is used by 20% of the users. In some places, that disparity is even more. And so making sure that the system is not making all of its money off individuals who have cannabis use disorder is critical. And it's as important to focus, again, on continued efforts to curb youth use, to curb driving while high, and to curb the other types of public health and public safety challenges that can arise and that we know arise in certain systems. So I'll sum up with a few takeaways, three important takeaways that I would argue for the legislature and for this work group to focus on moving forward. First, legalization, like any policy, is not a perfect one. If Maryland approves legalization, there are going to be challenges. There are going to be problems. But getting it right on the first try is not necessary. No state's gotten it right on the first try. And so legalization for some, I think, is perceived as the end of the road, of crossing the finish line. The reality is that legalization is the start of the race. Legalization is the first step toward making sure that a system reflects what the public wants, and that it continues to be effective, and where it is ineffective, that changes are made to make sure that solutions are put into place and that the problems are ameliorated. Next, when considering legalization, the legislature should not just weigh the pros and cons of legalization in a vacuum. They should compare it to the status quo, which is prohibition, and the cost that legalization creates financially, socially, racially, personally, and in its effort to achieve its stated goals, is important to compare to those same metrics, those same measures for prohibition. And so oftentimes I think people approach the legalization conversation and say, it might have this impact, and so let's not move forward with it. When you're doing that, if youth use is the issue, ask yourselves, what has prohibition done for youth use in the United States? A lot of youth in a lot of places, if they want to get their hands on cannabis in a system of prohibition, they can get their hands on cannabis. Building a system that makes it harder for youth to get their hands on cannabis is an important way to think about the youth use argument. And so any of the parts of the legalization conversation, like I said, can't just be compared to itself. It has to be compared to the existing policy of prohibition and whether prohibition has been successful or will be more successful than the opportunities that legalization presents. The third and final takeaway that I'll note is that there's no one-size-fits-all approach to legalization. And while a lot of lessons can be learned from the states, both good and bad, what I always argue is look to other states, identify their best practices, but also identify their worst practices and build a system accordingly. That is essential. But also, simply because a system or parts of a system work in one state does not guarantee that the clone of that system will work in another state. Maryland has to create a system that works for the geography, demography, business environment, existing tax and regulatory environments, and public expectations that that state has. They may be very similar to neighboring states. They may be very similar to states on the other side of the country, or they may be vastly different. And so making sure that that system is responsive to the realities on the ground and is not just taking a regulatory system, running it through a Xerox machine and changing the word Colorado to Maryland or the word California to Maryland is absolutely critical. You can learn a lot from your peer states that have legalized already, but you can't learn everything because Maryland's different than any other state, and any other state is different from Maryland. So I'm going to close there and happy to take your questions.
All right. So now we're open for any and all questions that we've got. I have a couple questions, and then I'll hand it to Delegates Wilson and then Dumais after that. And one of them is a little bit nitpicky and technical, but there were the questions regarding marijuana use, and I'm wondering whether that's a term of art, and whether there's a distinction between people in those statistics that have ingested it in different ways. So you have edibles, you have people who smoke it. I guess those would be generally the two ways people would ingest it. But having said that, is there any distinction in the information and the data that you've received that shows that there was an increase in one area as opposed to another?
So we do have some data. I'll forward. I had mentioned earlier. I'll forward along the report from Cato after the hearing is closed. I'll also send along a report that came out earlier this year from the state of Colorado, which is a really comprehensive and robust look at what has happened in their state. And we do know that certain age groups prefer certain product types or methods of ingestion relative to others. We do know that vaping is increasing among younger individuals. Now, that's true for cannabis. It's true for tobacco as well. We know that in some areas, the use of concentrates is significantly higher. Now, concentrates have some colloquial names like shatter sometimes you'll hear it called. That's ingesting through smoked form, typically a very high potency THC product. That is increasing in some areas. Edible use is particularly popular among women, particularly among older women. We found, and so to say that there are necessarily increases in certain types of methods of consumption, I think masks what is happening under the surface from demographic group to demographic group. We do know that smoking cannabis is still by far and away the most popular way of ingesting the product. But like any product market, as business owners become more creative and create more types of means of ingestion, the diversity in taste certainly changes as well. There have been conversations in other states, particularly around concentrates and around potency, that have played out, and whether certain types of potent products create other types of challenges within states. But despite those conversations, as I said, vaping, smoking, and edibles still remain by far and away the most popular forms of consumption of cannabis products.
Okay, I've got a couple more, but let's keep going with everybody else first. Delegate Wilson, then Dumais, then Moon.
Thanks, sir. Thank you, Mr. Chair. And so I really appreciate your weirdly unbiased. You're doing a wonderful job of presenting, just all the evidence, regardless how pretty it looks. One of the issues I have, and again, you've done a great job, but you kind of juxtapose Colorado and Maryland as far as a state to compare with. And one of my biggest worries about the direction we're going in is the fiscal impact, especially on minorities. We have the largest concentration of African American wealth in the nation, right here in this region, due mainly to federal government jobs.
Yep.
And you were talking about intergovernmental bodies, the competing non-alignment of the laws. Well, that impacts these individuals at a much greater rate. Yes. Because we're not Oregon, we're not Colorado. We have African Americans here are usually dual income families, either as contractors, some relation to the federal government where it's still illegal. And in moving forward, is there any instruction or anybody we can look at to see how that state handled this? Because my big worry is that we're going to lose our Black wealth. And also, you in addition to that, you covered the addiction side, because a lot of people won't acknowledge that. But I don't want to preclude a large swath of African-American young men and women from getting these jobs this next generation. And that's the worry I have here. So is there any information or advice you can give us on that?
Sure. Thank you, Delegate Wilson. You're obviously quite right about the significant amount of Black wealth in the state of Maryland, which has been a process for Black Marylanders over time, a hard-fought battle for that type of wealth accumulation that I think you're right to be concerned about and to make sure it doesn't go away. I live just across the border in Washington, D.C., a large African-American population, many of whom are federal government employees who face those same challenges. And so, yes, I think it's important to make sure that those there's a hyper awareness of those limitations. Until the federal government makes any type of change, those rules are going to be in place no matter how hard the Maryland legislature tries to make it for non-federal government jobs. But what I'll tell you, in my experience in talking to business owners, talking to regulators and others about this, you're right that the prevalence of federal government employees in Maryland is high. But in a place like Colorado, there's the Air Force Academy, there's large Air Force bases, there's our Supermax prison at Florence. There's a lot of individuals who work in the federal government in Colorado as well. There's also a lot of government contractors in Colorado working on defense-oriented projects who also, even though they're in the private sector, cannot use cannabis as part of their clearance process or part of their own employment. And what I've heard from a lot of business owners and others is that it does become a little bit harder to find individuals who are able to pass a drug test post-legalization than pre-legalization. But once people are on board, particularly for high-level white-collar jobs in government or among government contractors, it's not hard to keep them. People play by the rules once they're in those businesses, once they're in those jobs. It's just a little bit harder to get people there. Now, cannabis stays in your system for about a month. So if you can go a month without it, you should be okay to apply for those jobs. But I wouldn't worry so much about federal government employees in Maryland suddenly being kicked out of their jobs, because people know the rules in those federal agencies, and they might not be able to participate in the program, but they should be able to keep those high-paying jobs that have allowed for Black wealth accumulation.
And lastly, last question I have is also a business question, having more to do with the respondeat superior versus the employee rights. Because again, we're now talking about an employer's, if we legalize it in Maryland for recreational use, but I own a McDonald's, will I still have the right to say, no, it doesn't, I don't need to, do I have to provide rationale? How do you envision it to where it's one thing if I own a trucking company or construction company dealing with heavy machinery, and I can't, unlike alcohol, I can't look at you and see if you're drunk or not, but it stays in your system for 30 days. And so to me, as a greedy lawyer, it seems that if I caught somebody who had marijuana in their system, that's some money I'm going to get from my client if somebody's injured. Versus a person getting fired from McDonald's because they smoke marijuana. How do you live in that tension between protecting employees and protecting employer rights?
It's a hard public policy choice. I won't tell you it's an easy one. In a lot of states, they leave it up to the employer whether to continue drug testing. The case out of Colorado involves the company Dish Network, which has, the case had as sympathetic of a defendant as you possibly could have in a medical cannabis case. The person was terminated, and ultimately the Colorado Supreme Court said the termination was legal under the law. Some states have taken steps towards providing less leeway for businesses to be able to test or fire employees, but with exceptions for businesses that obviously were operating heavy machinery, medical, EMTs, things like that. But yeah, it's a tough public policy choice, particularly when you introduce the racial equity conversation into it. And so it's not one that I have an easy solution for. It is one that states have tried different approaches to, but I would say the majority of states give the power to the business to set their own rules and to administer drug tests or drug policy in the way that they see fit.
And that's done through legislation, because that's the worry is, and I keep thinking about these small Black businesses, and I don't want them to have to go through a lawsuit because they don't want to hire individuals that utilize marijuana just on their judgment. But you're saying they just do that through legislation to protect the business.
Protecting the business. So the business can choose to continue to test, to start testing, to not test. I mean, we saw just recently, Amazon, for instance, said that for a lot of its employees, it's going to move away from pre-employment drug testing because it doesn't necessarily see a need for it or it advancing a policy. So some businesses will take that approach, but others will either keep the drug testing in place, and there are legislative protections in place for those businesses.
Thank you very much, Bud.
Yep.
All right, we'll go to Vice Chair Dumais.
Thank you, Mr. Chairman. I have I think a simple question, but of the states that have gone to adult use legalization, how many of those states allow home cultivation?
Most of them do. There are a few that did not initially or still do not. Washington State was one that opted not to allow home cultivation in the state. In the state of South Dakota, for instance, there have been efforts. Well, South Dakota, they're trying to throw out their voter-approved ballot initiative as it is, and the legislature is currently trying to overturn the provision of the referendum that allowed medical cannabis patients to home grow. But your question is about the adult use system. Most of them do. Some of them have had more interesting approaches to it as well. So the state of Nevada, for instance, you can home grow adult use cannabis so long as you live more than 25 miles from a dispensary. So if you're in Clark County, where Las Vegas is, it's pretty hard to be in Clark County and be 25 miles or more from a dispensary. But in more rural Nevada, especially in counties that have opted out, it's quite easy to be 25 miles from a dispensary. So that's a more innovative way. Now, Maryland's not Nevada for a lot of reasons, size in particular. But yeah, most states, I don't have the number in front of me, but most states still allow home cultivation.
And would that specific number be in the Cato report?
I don't know if that number is in the Cato report, but I can provide it to the work group.
Okay, that'd be great. All right, thank you very much.
Yeah.
Before I send it to Delegate Moon, let me come back to youth use. On the third slide from the end of the PowerPoint deck, you provided a chart that showed high school students past 30-day substance abuse, and it compared marijuana use to cigarette use to alcohol use. And so my question actually kind of revolves around the significant drop between 2005 and Dylan's, I think I'm going to put it up, here we are. The drop between 2005 in cigarette use and in alcohol use, pretty significant drop in those two areas, but the relative stability of marijuana use. This could be, I don't know if they had looked at this a little closer, but is there do you have any insight as to what Colorado was doing that resulted in the real and significant drop in alcohol and cigarette use that was not having an impact on the use of marijuana?
Sure. There are two factors that I would argue have an impact here. I will not say, Mr. Chairman, that they are the exclusive factors that would have that impact, but I think they would account for a significant part of it. First, you have significant state and federal anti-smoking and anti-drinking campaigns that are in place that happen through media, happen in schools, et cetera. Those could have an impact over time for sure. The other two is we know that in states, and this is true in Colorado as well, that throughout the 2000s and into today, there have been markedly increased efforts to improve compliance for ID checks within establishments selling both tobacco and alcohol. And those increases in ID checks that in some places are significant. I could send a report along to you from the state of Washington that looked at the increases in ID checks from 2016 to 2019, like I said, in Washington state, that shows the ID checks for cannabis businesses have been quite high and quite stable from 2016 to 2019. And they increased significantly from 2016 to 2019 for alcohol and tobacco. So if you extrapolate those types of increases in ID check compliance in alcohol and tobacco products from a state like Washington. If that was happening in a state like Colorado, you could imagine it having a pretty significant impact on those products, on Colorado's alcohol and tobacco products as well.
I was going to say, to your first point, I don't believe that there's been a significant lack of anti-drug messaging and anti-marijuana messaging, particularly in the first part of the time frame that was in that chart, especially the 2005, maybe into the teens. So it was just interesting to me that there was a dramatic drop in those other two areas, but in alcohol and cigarettes, but not in the marijuana part. And so your second part is interesting to that point. I was going to ask a question about, you made a point about adults not wanting to reveal that they used marijuana. You didn't make a similar point about youth. And I kind of wonder whether that has an impact on the numbers a little bit too, whether the numbers might actually be probably in some cases higher.
Yeah, what we do know is that in states that have legalized cannabis, there are data that suggest that youth don't see cannabis as much of a threat or as much of a problem as they did previously. Now, that doesn't correlate with increases in their own use. But in terms of perception of harm, that number has decreased. And there's a couple of ways to look at that. One, it could be, if mom smokes a joint on the weekend or dad has some edibles at night, then seeing your parent actually use that, or friends' parents use it, it could decrease that. The other, though, and this is, I think, a very important point, is that for decades, adults and youth were being fed significant misinformation about the harms of cannabis and what it would actually do to you. Some of them wrapped very tightly in a racial message, some of them not wrapped in a racial message. So what might actually be happening is that youth have a more accurate appreciation of the harms of cannabis now. And while that number has decreased, it doesn't necessarily indicate a lack of an understanding of harm, but a more targeted appreciation for that level of harm and what it can mean.
All right. One last brief question. You indicated early on about sales revenue versus tax revenue. You're into the numbers that you put up for Colorado was just effectively the gross revenue for all sales, not necessarily what the state took in actual tax revenue.
Yes.
The sale. Okay. Just,
That's right.
I think you said that. I'm just making sure. They did not make $2 billion in tax revenue.
Correct. That was direct economic activity of sales. Yep.
All right. Thank you very much for that. We'll go now to Delegate Moon and then the Vice Chair, Delegate Pena-Melnick. Delegate Moon.
Thank you, Mr. Chair. So first, let me just second the Vice Chair's interest in some of these home cultivation questions. And I would tab that both for personal use and for medical card holders. And again, I flagged this just for the committee or this work group as since it's an organizational meeting that to me that's of interest to figure out. We sort of left that unanswered in the medical context too. But here's my question. This question about equity, and I flagged this during the medical and now again through the adult use conversations. In the state like Maryland, where our medical system has essentially been a very restricted number of licenses, some would call it a monopoly market, the question of equity becomes almost like a lottery if there's only 15 licenses to begin with for some of these top licenses. And, I just want to add some real world dynamics here, which is that the dispensaries closest to me, except for one family owned one, keep getting sold and resold to different multi-state chains anyway. And I don't even know how you count the question of diversity when that's going on, and when the underlying licenses for a multi-million-dollar growing facility are held by an investor pool. So I find the question of equity here, even if we were to construct it perfectly, would it last? Is it sticky? And is there an easy way to even calculate this when investor pools are doing so much of the license holding in our state. So that's sort of one question. If there's actually even a framework you think makes sense for us for how you calculate these things. And then the second is, seeing as how that's one complicated scenario that we've got to deal with, the other question I have is, additionally, has any state you've looked at come up with a micro license or small business strategy that gets at these equity questions, that doesn't rely on multi-million-dollar investor pool? So it's, I'm curious about equity on both counts.
Sure.
Equity among millionaires and equity by letting small business participants in, and who should we be looking at that's done something good on these?
So great questions. The issue of business license transfers, essentially business sales, is a really confounding one for a lot of states. Some states have considered putting restrictions in on how quickly, how often a license can be sold, to whom a license can be sold to. So if you have essentially set-aside licenses for minority owners, there can be systems put in place where those can only be transferred to other minority owners. The challenge that becomes there, that comes there, is if there is no minority owner willing to buy that license, what then happens to that license? And if it goes unused, then the remainder of the market just simply redistributes to other license holders, to other businesses. And so, yeah, it's very difficult, particularly, as you said, for when multi-state operators enter the game with equity pools for ownership, to understand, A, whether there is actual true minority ownership of a business, or whether it has been watered down, diminished significantly by other investors, et cetera. And the way around that, I honestly can't tell you in an easy way, because of the way, if you're going to have a capitalist system with some free market aspects to it, you know, the best laid plans can easily be eaten up by just the forces, of the market. There are several states for minority licensed business owners where there are 51% stakes required for either an individual who is a person of color or a group of individuals who are people of color. But states have even struggled to be able to track down the accounting on that, to be able to do the accounting to make sure that the businesses who claim they fit that mold actually do end up fitting that mold. And so it creates an additional financial regulatory challenge for the states that have tried to put those rules into place. Micro business licenses are one area that states have thought might be an opportunity to thrive. Now, California has done this broadly. Oakland specifically has sought to do this, and they've paired micro business licenses with incubator funds, as well as peer-to-peer, business-to-business assistance for things like regulatory compliance, accounting, et cetera, to help new business owners get up and off the ground and understand how not just to have a micro business license, but to run a micro business. And it is seen as a means or the ability to begin to grow wealth and to grow a business, and then perhaps to be able to transition into the, let's call them non-micro business or macro business licenses. But that's also a slow process. And it can be restrictive, it can be diminishing, but it is something that other states have sought to do. In terms of the broader issue that you're touching on, I think if a state is going to seriously consider how to increase diversity in the cannabis industry, whether it is among larger businesses, smaller businesses, businesses that are medium-sized, it's important to avoid what were some of the early mistakes that I touched on previously, which was simply granting access to applying for a license or having a set aside for that license is not enough. Creating avenues for capital and increased capitalization or investment, as well as basic business training. For a lot of individuals, especially people of color who are looking to get into the cannabis industry, whether they're successful or not, oftentimes this is their first business ownership opportunity. A lot of new businesses fail inside and outside of the cannabis industry. And so in a lot of other industries, state governments don't care as much outwardly don't care as much about equity as state governments do about cannabis. And so making sure people are well prepared to run a business, grow a business, and for that business to thrive can be built into the systems in ways that allow communities to help these businesses, to allow a community of individuals who have been successful in other businesses, non-competitive to the cannabis industry, to help those individuals do well and have some of the benefits that wealthy business owners from wealthy white male business owners or MSOs already have going for them, to get them in on the ground floor, like Delegate Wilson and I were discussing before. Making this work out of the gate is essential, because if you're going to try to do this 10 years down the road when the market is matured, it's going to fail, and the victims of that failure are going to be Marylanders of color.
The Vice Chair, Delegate Pena-Melnick.
Thank you, Mr. Chairman. Just following up on that thought, for us to get it right out of the gate, right? There's 19 states that have legalized it, Connecticut being the last, correct?
Yes.
And Connecticut had a big discussion on what equity meant, right?
Yes.
And I mean, the bill almost fell apart at the end because of that. Can you discuss how Connecticut dealt with it? Because they did it in an interesting way. And do you recommend that that's the way Maryland should do it? Because I'm assuming, since it's the last state, that it has sort of learned from people's other states' mistakes, right? And is that the one that is the most perfect? If I may ask you, I hate to put you on the spot, but you are a great expert. You're doing a great job answering these questions. So thank you for the consideration.
Thank you for the question. As someone who was born and raised in Connecticut, I'll tell you that the system's perfect and doesn't need any adjustments. But on a serious note, I'll discuss a little bit about how that debate that you mentioned played out, and then I'll offer some thoughts on that debate. There was a real, essentially a standoff between the governor and the legislature about exactly what you mentioned, Madam Vice Chair, about what equity means. And one of the real sticking points was whether equity applicants who were had past criminal convictions for a cannabis-related offense would automatically be considered eligible for an equity license or not. And the concern was that there would be a lot of white, particularly white male individuals who had previous low-level cannabis convictions who would go in and scoop up all of those equity licenses, and the people who would not then benefit were Black and Latino individuals who those licenses were actually intended for. Ultimately, Connecticut opted not to include just the simple blanket designation of having a past criminal conviction as eligibility for equity, to shift the eligibility for equity toward Black and brown nutmeggers. And so I think that is smart. What we know about the criminal justice system and the effects of the criminal justice system are this. First, that Black and brown Americans are much more likely to be introduced to that system than white Americans, even for something like cannabis, where white and non-white individuals use at the same rates. Second, white individuals who go through the criminal justice system tend to get lighter sentences, have better representation, and have better outcomes than non-white defendants in those cases. Third, we know that post-release or post-conviction, white individuals are going to have greater access to opportunities than non-white individuals have, even for individuals convicted of the same crimes or having the same sentence. And so I think thinking about equity in a dynamic way can be important, but recognizing who has suffered most under the war, during the war on drugs, it is important to make sure that those issues of equity continuously redirect back to Black and brown communities, particularly in urban areas, and Native communities too. It's important not to leave out Native communities who have been tragic victims of the drug war as well. and to make sure that you don't create a system that simply creates an additional carve out for white individuals who did not endure the same effects, even for the same crimes, that allows them to scoop up all of those equity licenses. And so I think if Maryland thinks about equity in that way, and like you said in your question, Madam Vice Chair, asks that question explicitly. I mean, a lot of people use the term equity and they're all talking about different things from one person to another to another. So the legislature and this work group asking, what do we mean by equity? And maybe the definition of equity in one part of the bill is different than the definition of equity in another part of the bill. Those definitions and the dynamism of those definitions is absolutely essential for you to advance the goals of not just you as a legislative body, but the constituents you represent who have really endured this war on drugs for decades.
Thank you so much.
Thank you very much. I think this is going to be our last question of the afternoon, but Delegate Wilson is making his second bite at the apple, so we'll do that. Third.
I apologize, Mr. Chair, but I have to, because, sir, when you multiple times you were mentioning equity licenses, people of color, minorities. What I want to know, and are you familiar with the Pickford v. Glickman lawsuit?
I'm not, sorry, sir.
That's fine. It's because my question was, the Pickford v. Glickman lawsuit was basically settled that because the USDA denied African-American owners, farmers, loans for over 100 years. And as such, we lost 99% of all of our farmers. And in doing a disparity study, they found, and then they did a second part for the American Indians who also lost their land. My problem is when we conflate and we say Black and brown people, there is a disparity study showing that African-Americans' land were taken and the right to grow and have horticulture, which is indeed growing marijuana, was taken from them. So I get concerned when you conflate, because even during the Obama era, when they had a bunch of Hispanic folks try to jump on the Pickford v. Glickman, it was said no, because you weren't denied land. My issue, again, goes back to the disparity study that when we talk about Black and brown, are you using a study? Are we just making a very loose statement on that? Because go ahead.
I was just going to say, so we know that arrest rates for cannabis-related offenses are highest for Black Americans, particularly compared to white Americans, but Latinos are arrested at higher rates for cannabis-related offenses, and white Americans are too, but in most places it is lower than it is for Black Americans. That's not necessarily true everywhere, but it's generally true. And so when and Native Americans as well have been victims of disparities in arrest rates as well. So when we're talking about the effects of the war on drugs, the Black community has absolutely been hit the hardest, but there have been a lot of victims relative to the white community. And the other side of it too, and it's typically not introduced into the equity argument, we know that poorer Americans, regardless of color, have been victims of the drug war as well. And so, again, thinking through what we mean by equity, when you're talking about land denial, particularly for Black farmers, I was not familiar with the citation of the case. I am very familiar with the policy. That is a very significant issue, and it came up it came up significantly in the conversation around hemp legalization and the opportunities for Black farmers, particularly in Eastern Kentucky and in Eastern Tennessee, around this in Northern Georgia, around what happened historically with Black farmers' land being taken away, and whether the hemp legalization conversation was over-promising to the people for whom land had already been taken. Right. And so I think having a sensitivity to the past realities of those types of racial disparities are important. And what has happened in terms of racial disparities in Arizona or Texas or Montana might be very different than the racial experience that has happened in Maryland. And so I think when we're thinking about how we deal with the effects of the drug war, you can have that conversation nationally, but you need to have that conversation at the state level and even at the county and municipal level, where experiences might be different from group to group.
And I was only asking this as it applied to business contracts, things of that nature. When the disparity study is usually required, ergo, you have to prove that a certain population was denied access, something of that nature. I was not going on the arrest and the criminalization, i.e. war on drugs. That's why I was wondering when you were talking about disparity, because I know for contracts, things of that nature on a federal level, to have a disparity or to have a set aside, you need to have a disparity study or some proof. That's so I guess we're talking kind of two different things, but I get
Yeah,
you.
I think we're the same word with a couple of different meanings.
There you go. Thank you, sir.
Thank you.
All right, thank you very much to Dr. Hudak for joining us today. We appreciate your time and your expertise. If you have questions, anyone on the work group has further questions for our guest, I think we got a lot of questions out there though. You can email Dylan Goldberg in my office. He'll connect you. The House Cannabis Legalization Work Group will continue to meet, and all of our future dates, along with materials from today's meeting, will be posted on the work group page on the Maryland General Assembly website after this meeting concludes. This work group will meet again on Wednesday, the 9th of October, regarding the topic of health determinants related to cannabis. When we have more information, specifically the time, we're working on the time for that meeting on that day, we will send an email to work group members, and we will post it to our webpage on the General Assembly's website. With that, we thank you all very much for your attention. Thank you very much for all of your questions, and we will see you again on the 9th. Thank you all.